when we look at all these different studies from around the world, we can consistently see that if you're vaccinated, you are less likely to suffer severe outcomes from COVID. And that's really the goal, right? You don't want to end up in the hospital. You don't want to end up with debilitating disease. And it makes sense that you can prevent all those things with a vaccine that's giving you a piece of the virus, essentially. It's introducing your body to the virus, letting your body like treat it as a punching bag, learn from it, get like tactical information on the enemy. And then when it sees the enemy, it knows what to do. So again, we can see that for all age groups. And, you know, just scrolling down your page on Twitter or seeing the kinds of things you say about COVID vaccines, you would, as a reader, I get the impression that you are saying that we don't need them and they're harmful. Like, you know, it's
okay. I don't think, I feel like that's a bit of a straw man of my position. Okay. To be honest.
So yeah, go ahead.
Okay. No, I was going to say, like, so I'm not going to push back on all of these numbers. I haven't looked at the South Korean study and so on. I would make a couple of points on it. I mean, the first one that I would say is, look, 46 young people dying. What's that age group, by the way? That 46?
18 and under.
18 and under. Okay.
But in America, we had about.
I'd love to see wider numbers. Oh yeah, what was it in America?
Sorry, in America, it was about 2,000 kids throughout the whole pandemic, 18 and under.
Okay, so 2,000 over a 3-year period. Is that fair to say?
Mm-hmm.
Yeah.
Most unvaccinated. Yeah.
Okay. But also mostly with comorbidities, right?
No.
Is that fair to say? Mostly not with comorbidities?
Right. So there was a study that looked at hospitalization and ICU admission rates in children, COVID cases. And it found that about 30% did not have comorbidities. Am I still with you? Your screen's frozen a little bit.
Okay, sorry.
You back?
I don't know what happened there. Yeah, I'm back. Carry on.
Okay. Right. I was saying that about 30% of the kids that were studied had no comorbidities. That's 30%. But 90% of the kids admitted to the ICU were unvaccinated. So, you know, you can't always predict who is going to be at risk based on pre-existing conditions. And that's the important thing when it comes to public health. Like, you don't know necessarily who's vulnerable. There have been plenty of healthy people who would consider themselves healthy, be seen as healthy, who have suffered of COVID and who have died of COVID. And if that suffering is preventable, then it's worth preventing that suffering with the tools that we have at our disposal.
Okay. That's interesting. I mean, directions to go here. So I think, okay, what's the first point I'd like to bring up here? I think the first point I want to bring up is, I think that throughout this entire situation, one of the issues that I've certainly had with it is this is a real multivariate situation. And the sort of simplification that's been done through all the communication from the public health officials, from the politicians, people pushing policies and so on, and from the media, even in terms of the way many of the statistics are done, has simply been unvaccinated versus vaccinated, which, if you're talking about something as multivariate as health outcomes, is ridiculous to me, especially when you consider that the vast majority of people at least vast majority of adults in our countries who died were overweight, obese, I think a ridiculous proportion had vitamin D deficiency. So there are other factors that go into this. So I think even the simplification of just making it as vaccinated versus unvaccinated, not only did it lead to a lot of the divisive stuff, which obviously I take issue with, but I think it's also not, I just don't think it's an honest, and again, if we're going to talk science, I don't think it's a very scientific approach to just say, okay, well, we've got a massively overweight and obese population, and most of the vast majority of the healthy people, whether they're vaxxed, unvaxxed, or whatever, they're doing fine. But actually, obesity is a gigantic risk factor to this thing. As far as I'm aware, in the UK and in the US, I'm not sure if at any point it was suggested that people supplement with vitamin D. I don't know if it was I certainly don't know if it was recommended at any point that people get their butt to the gym and they lose some weight and they take care of their nutrition and they do various other things that they can to boost immunity. It all just came down to mask, vax. And to me, as someone who is a health advocate, this is not a holistic health approach at all. And so this is where I think some of the so-called quote unquote conspiratorial thinking comes, because it's like, well, if this thing is simply just about health, there are a lot of questions here. Why are you shutting down gyms? Why are you shutting down public parks? Why are you shutting down beaches? Why are you telling people not to go outside and not to get that vitamin D? Why are you telling people just to put on a mask and take the vax, but you're not encouraging them to lose weight? You've got people who are 50, 100, 200 pounds overweight, and there's no messaging at all, even suggesting them. And again, this is like over a long period of time, suggesting, hey, these are other things that you can do to improve your health. So what are your thoughts? What are your thoughts on that?
Yeah, so I'd push back on a lot of things there. So I wrote down comorbidities. So let me just clarify that. So I think that a lot of people hear comorbidities and they think things like diabetes, obesity, asthma, things like that. And when you hear that people who died of COVID-19 on average had like 3 to 4 comorbidities, I mean, that's been said a lot, like on Joe Rogan and things like that. But that's not really, I think that misses what a comorbidity is when it comes to a death certificate. So a comorbidity on a death certificate is anything that contributed to the death. So a typical COVID-19 death certificate might look something like respiratory failure due to pneumonia due to COVID-19. That's at least 2 comorbidities contributing to COVID-19, but they were caused by COVID. So the actual numbers on how many people were obese or had diabetes might be inflated if you are thinking about comorbidities in just that, in a way that says that they're just those things, right? So I could get you the numbers from America on that breakdown, how many people died from COVID who were obese, had diabetes, et cetera, et cetera.
Okay.
It might not be.
Just to jump in there, the number that I remember seeing, which I've just looked up very quickly, this is the thing that pops up first is from 2021. Actually, I've seen something from 2022, and it's saying that over 75% of the people who were hospitalized were overweight or obese, and that's coming from the USA. That's from the NIH and the CDC.
Mm-hmm. Yeah,
I know that 70% of the American population is overweight and obese, so that's not.
Yeah.
that probably doesn't help.
But if you say if you had overweight to obesity, then that's broadening it a lot. Yeah, that's just one thing. You know, maybe comorbidities might be reframed a little bit if you look at like what's actually classified as a comorbidity upon death. But then you also said vitamin D. There hasn't been any data suggesting that vitamin D supplements help fight COVID. There's a common misconception that there's a stat that's also commonly reported that most people who are hospitalized with COVID, when they test them, they have low vitamin D levels. And that is normally a result of COVID itself. There's an analogy here where it's like if you're a firefighter and you go to a fire and you're like, holy shit, there's ash and smoke everywhere. Let me get rid of the smoke and the ash and that'll solve the fire. Like, no, the fire is causing the smoke and the ash. And in this case, the smoke and the ash is a vitamin D deficiency because your body is fighting off a virus. You are getting into a state where you can become vitamin D deficient. And even in that case, there have been studies looking at, can we treat COVID using vitamin D? Like once someone comes into the hospital and they're vitamin D deficient and they're hypoxic, can you treat them with vitamin D? And you can't. It doesn't work. Like doctors have tried it because doctors honestly want their patients to.
Just to jump in here, though, I mean, isn't it
Yeah.
well known? Isn't it scientifically established that vitamin D in general is very good for your immune system? I mean, the fact that COVID itself, that the virus itself can deplete your vitamin D levels, that would suggest that as a preventive measure, it would be important to have those topped up either just from natural sunlight or from some type of supplementation. Or am I missing something there?
Well, so if that were true, then if we give it back while your body's fighting COVID, then that should help, but it doesn't. And
Well, I
then,
think there's
but
prevention
also,
versus cure are different, no? I mean, if
so
you
yeah,
gave someone a COVID, okay. I was going to say, I mean, you're obviously very pro-vax, and I'm saying, surely if you gave someone the vax once they'd already succumbed to it and been hospitalized, would that? I doubt that would necessarily help them, even assuming that the vax is effective from your position.
yeah,
I
no,
don't know. Yeah,
yeah, that's not how vaccines work. And
yeah, yeah.
you're right, and I see what you're trying to say,
Okay.
but also, if you there have been studies that look at what happens if you supplement with vitamin D. Does it help protect you against respiratory diseases? And the consensus is that no, it really doesn't. And the reason is that most people aren't actually very deficient in vitamin D to the point where it can be, detrimental. A lot of times when if you're not malnourished, then you shouldn't need vitamin D. And very few people, even if you're obese and you're not eating well, you're probably not malnourished, right? There's a difference between not eating well and not.
I thought vitamin D deficiency is actually really common, especially in
not
certain climates and areas.
so maybe in climates where, like in the north, like in Northern Europe, it can be more of a
Mhm.
problem. But it's not really so common that it's not common to the point where it's going to put you at risk of infectious diseases. And that has been shown with these vitamin supplementation studies, where there are actual randomized controlled trials where people take vitamin D or don't, and the outcomes with respiratory illnesses are not significantly different.